This tutorial explains the region of the axilla. Once you complete this video, you will be able to identify the boundaries and walls of the axilla, the major contents of this region, and the axillary spaces. The axilla, commonly known as the armpit, is the gateway to the upper limb, forming an area of transition between the neck and the arm. The axillary region is made up of the clavicle, the scapula, the upper thoracic wall, the humerus, and the muscles. It is an irregularly shaped pyramid space directed medially and upwards with 4 sides, an apex and a base. The apex is the upper end of the axilla and is directed into the root of the neck. The apex is bounded anteriorly by the clavicle, posteriorly by the superior border of the scapula, and medially by the outer border of the first rib. The base is the lower end of the axilla and is bounded anteriorly by the inferior border of pectoralis major and posteriorly by the tendon of latissimus dorsi and teres major, and medially by the lateral thoracic wall. The axilla has 4 walls: the medial wall, the lateral wall, the anterior wall, and the posterior wall. Now let's look at the muscles that form these walls. The anterior wall of the axilla is made up of pectoralis major and the underlying pectoralis minor and subclavius. The posterior wall consists of subscapularis, teres major, latissimus dorsi, and the long head of triceps that passes vertically down the wall and into the arm. The medial wall is formed by the upper 4 or 5 ribs and the intercostal spaces covered by serratus anterior. The lateral wall is formed by coracobrachialis and the long head of biceps brachii in the intertubercular sulcus of the humerus. Now let's move to the contents of the axilla. The contents of the axilla include the axillary artery and its branches that supply blood to the upper limb, the axillary vein and its tributaries, lymph vessels and nodes, the cords of the brachial plexus, and the intercostobrachial and long thoracic nerves. Next, we will discuss the axillary spaces. These are anatomic spaces through which the axillary contents leave the axilla. They include the quadrangular space, the triangular space, and the triangular interval. They are bounded by teres major and minor, the medial border of the humerus, and the long head of triceps brachii. The quadrangular space provides a passageway for nerves and vessels passing between the axilla and the more posterior scapular and deltoid regions. When viewed anteriorly, the boundaries are formed by the inferior border of subscapularis, the superior border of teres major, the surgical neck of the humerus, and the lateral margin of the long head of triceps. Passing through the quadrangular space are the axillary nerve and the posterior circumflex humeral artery and vein. The triangular space is an area of communication between the axilla and the posterior scapular region. When viewed anteriorly, it is formed by the medial margin of the long head of triceps brachii, the superior margin of teres major, and the inferior margin of subscapularis. The circumflex scapular vein and the circumflex scapular artery pass through this space. The triangular interval is inferior to the posterior wall of the axilla. It is bounded medially by the long head of triceps brachii, laterally by the shaft of the humerus, and superiorly by the inferior margin of teres major. The radial nerve and the profunda brachii artery and vein emerge from the axilla by travelling through this interval to reach the posterior compartment of the arm.